I'm Chris. I'm an Albertan in my 5th year of long-term recovery after spending many years in addiction. Drugs were a part of my life from birth. I chose to use fentanyl and meth, often using at home. Both my parents were also in active addiction. These drugs took me to the streets. I was homeless for 2.5 years. I lost all hope, and I stopped seeing the good in the world. I stopped seeing the good in myself. As my drug use progressed, I found myself using at home more and more. I didn't want people to know how bad it was for me. I overdosed several times. At those times, I was lucky enough not to be alone, and emergency services saved my life. I'm excited to be here today, both because I am in recovery, but also because I believe in this system. It might help others find recovery as well. I can't help but think about how many of my friends who have used at home, often alone, and didn't make it. If this professionally monitored system was available, they might be able to be alive today and be living a good life in recovery, surrounded by friends and family. I've come to love my life in long-term recovery. I work as an outreach counselor for a treatment center, helping others like myself find long-term recovery. I am now able to live a life I never had a chance of living. Thank you again, Minister Luan, Premier Kenny, and the Alberta government for investing in this system and for your commitment to transforming the addiction and mental health care system in Alberta and building the Alberta model.
Today, I am pleased to share more news, another initiative that we're adding to Alberta's toolbox, the Digital Overdose Response System, or the DORS. DORS is a mobile application that will help protect people using opioids and other substances while alone. The system is one of the first in Canada and built on a reliable technology that already been used to ensure a person's safety while working alone. Albertan using opioids or other substances alone will be able to use DORS application, which has a timer connected to the alarm system. If the individual does not respond when prompted by the alarm from the application, a dispatcher from the STARS response center will attempt to contact the individual. If STARS doesn't receive a response, emergency medical services will be alerted and dispatched to respond as a presumed overdose. This app will also provide information on national, provincial addiction recovery support services like virtual opioid dependency program, which has 0 wait list, helping ensure people who have information that they need to move toward their journey of recovery. This application has the potential to do so much good for people who are using substance while alone, often at home. Data from our past 4 years shows that majority of people dying as a result of accidental opioid poisoning do so in their own homes. In 2020, 70% of overdose fatalities in Alberta occurred in a private setting. This is tragic and preventable. This application will be rolled out as we speak and getting tested in Calgary over the summer. Calgary has consistently had one of the highest number of overdose-related fatalities in the province, and for the last year has had one of the most suburban deaths when compared to other areas in this province. Today, we're announcing that we're moving into a phase while this application will be engaged publicly with other stakeholders and doing the rollout. This phase will be several months in testing, implementation, and adjusting, and we look forward when we can take this application provincial-wide when it's ready. Our priority is the safety and the security of Albertans, and we want to make sure the application is functioning optimally before we expand its service provincially. Our ultimate goal is to expand DORS applications throughout the province at its earliest time possible.